Everyone, thank you for joining us. My name's Megan. I'm the marketing specialist with Eganberger and Weiner. We are a financial planning company in Vienna, Virginia. With me today, I have Dr. Colleen Cordero, who is the Director of Audiology at Ear, Nose, and Throat Specialists of Northern Virginia. Thank you for joining me today.
Thank you so much for having me. I'm really excited for the opportunity to answer all of these questions that we've got ahead of us. I have been the Director of Audiology at Ear, Nose, and Throat Specialists in Northern Virginia for almost 15 years. We have a group of 5 otolaryngologists, 7 audiologists, and 3 nurse practitioners that have served the Northern Virginia area for 50 years. This year, we're celebrating our 50th year in practice. We have 3 locations. One of our offices in Arlington, Virginia. The other is in Manassas, Virginia, and we have another office in Springfield, Virginia. So kind of right around the Beltway. It has been really exciting to sort of see how the field of audiology has developed in the last few years as there has been technology advancements and more research related to specifically how hearing relates to patients' overall health and well-being. So I'm excited to talk about that today.
That's really exciting. It's really exciting for 50 years. So congratulations to you guys on that.
Thank you.
So we do have a couple of questions for you. Like you mentioned, one of the first one, what correlations have you noticed with the aging population and how hearing loss impacts their life?
Right. So hearing is a critical sense. And in that regard, it does have impacts on patients through just about every aspect of their life, social, emotional, physical. It really does impact all aspects of our patient's life. When patients do experience hearing loss, you can see that they're, not feeling as engaged or connected to their community. And that does, have some downside effects. I think it's really important to help patients recognize that there is something that they can do about their hearing loss, and that when they're managing their hearing loss better, it's immediate improvements that you can see in patients' overall health and their general wellness.
You mentioned overall health and wellness. That's fantastic. That's something we want to focus on, especially with our quarterly newsletter and kind of a focus on that overall health. So, what steps can be taken to assist them with that overall health as they age? What can be done to prevent hearing loss as people do start to age?
Yeah, that's a really good question. So, there's some types of hearing loss that are preventable, so like noise-induced hearing loss. So, being really conscious, when you're going to those louder concerts or sporting events, or even when you're just out mowing the lawn. So, when you're in the presence of loud noise, it's always going to be important to protect your hearing as best you can. The other thing that's really important to kind of understand is that for many patients, hearing loss is, inevitable, that, their genetic makeup, mom, dad, brothers, sisters, everyone has hearing loss, but we expect that as people age, that they're going to experience hearing loss. So the one thing that's really important is prioritizing getting baseline audiometric information. So, a hearing test before you think that there's a problem. So it's a good idea to have a hearing test between ages like 18 to 40. If you notice a hearing loss sooner than that, you certainly want to be evaluated. Those folks that, are in that range, getting a hearing test every 3 to 5 years is good practice. Between, ages 65 and 74, 1 in 3 patients are experiencing hearing loss. So when you're in that range of like 50, 60, 70, you're probably experiencing some degree of hearing loss. And then when you've been diagnosed with hearing loss, you want to monitor your hearing much closer. So every year or two sooner if you've experienced a change, like a sudden change in your hearing.
Quick follow-up question for those that might be intimidated by sort of that baseline test.
Yeah.
What does that involve?
So, there are some really awesome primary care doctors who have screening measures in clinic. And so that's like one option. The other option is you schedule a audiogram with an audiologist. You come into clinic, we'll take a peek in your ears, make sure that your ears are nice and clear, that you don't have any wax or debris that could be contributing or compounding the degree of loss that you actually present with. And then we, do a beep test. You're going to be, pushing a clicker as soon as you start to hear the beeping, repeating back some words, softer words, and then words that are a comfortable listening level. But really, it is, you know, 15 to 30 minutes of your time to get that data point that will be really helpful, moving forward in how your hearing loss is treated and managed.
So we've talked a little bit about what that process might look like when someone wants to get their baseline tests done. Now, what age do you typically see clients first starting to get hearing aids?
That's a good question. So most patients are between ages 50, 60. That uh, in this area, that average age, I think, is probably a little bit lower because in Northern Virginia, patients are really proactive about their health and their access to care is, much more convenient than some people in other parts of the country. What I would say is that, again, the odds of a patient between that 65 to 74 range being 1 in 3, that's going to be that kind of window of time where most patients are pursuing interventions.
We've talked a little about the social impact in that environment and how you can see the trickle down effect there from hearing loss and how that can relate to someone's life. What other impacts have you seen hearing loss have on someone's overall well being?
This is a really good question. So, aside from the audibility, which is, like you mentioned, the social impact, how are you engaging with your family? How are you engaging with loved ones and kind of navigating your day to day? The other piece is the cognitive piece. And so, there's been a lot of conversations, there's a lot of research, that's really been focused on understanding better the relationship between hearing loss and cognitive function. And that I think is, in a lot of ways, just as important as the impact that it has on audibility. Patients who have untreated hearing loss experience cognitive decline at a significantly faster rate than their peers. And so that part of it is, something that as um, healthcare professionals, we will naturally prioritize. So the sooner you identify that a patient has hearing loss, the sooner you manage that hearing loss with, amplification, the better those long-term, prognosis or long-term outcomes will be for that patient. We're encouraging patients to be more proactive in getting those exams done earlier and getting their hearing, baseline hearing tests, and then following up with treatment when it's necessary. That part of it really does have a positive impact on long-term prognosis and how we are managing your hearing health, that audibility piece of it, but also your cognitive health.
How have you seen hearing aids prevent other issues? For example, preventing falls in the elderly.
Right. So hearing aids really just kind of give you better awareness of, where you are in your environment. There's been more research specifically that looks at how hearing aids can improve spatial awareness and balance. Hearing aid wearers, the last research article was that 50% reduced odds of experiencing fall compared to non-users. So really powerful evidence that, suggests if you're hearing better, you probably have, better awareness of obstacles in your environment that you can kind of avoid for sure.
So, alongside with that kind of awareness, what conditions can hearing aids assist in?
So There is a lot of research that has really taken a deep dive into the positive effects of treatment and management of hearing loss and hearing aids. There has been shown improvement in balance, slowing of the rate of cognitive decline, reduced depression and social isolation. So, you know, it kind of going back to, well, what are the risks? There's very little risk to treatment and management of your hearing loss, and it's the number one modifiable risk for cognitive decline. So if you're treating and managing your hearing loss, you can have a significant impact on the likelihood that you'll experience cognitive decline. Social engagement, I think, is going to be number one, aside from, the cognitive benefits. But being able to stay engaged with your family, being able to stay engaged socially with friends. Again, social network is going to be something that, as you age, is only going to make, your life better, but also your whole health and wellness better by, maintaining those relationships. If you're not hearing, you're not able to do those kinds of things like you were. And so it just creates more challenges or more obstacles if, you go out to lunch in a noisier restaurant and you can't have the same kind of dialogue that you once did. So I would say that that is, a really important piece. It can create a lot of frustration for families, if your children or your grandchildren aren't able to hear you and aren't able to communicate with you. And so that, I would say, is, from a provider standpoint, one of the most exciting things to see is that re-engagement and those relationships with the loved ones that, patients have around them.
I think that's a great point, and I think that kind of segues into our next question, that if someone's considering a hearing aid, they might be on the fence, they might be afraid or concerned. What will their family think? What will a grandchild think? Or is a grandchild going to be scared of what, we think of this big device on their ear? Do you
Yeah.
have any advice for them there?
Yeah, that's a good point. I mean, and it's certainly true. Kids are so curious and they really do say kind of funny things about hearing aids. I always recommend that patients kind of like, you know, try to be as transparent as they can with the loved ones and answer any questions, especially with the kids. We'll compare them a lot to glasses. Glasses, they help grandma or grandpa see better. Hearing aids are just going to let me hear better, so I can hear you when you're really, whispering really quiet or you're talking really far away. And I think if the kids recognize that they're helping and they're, a lot smaller and, more technologically advanced. I mean, hearing aids nowadays, like grandma could listen to her music through through these hearing aids. So that part of it, I think it's a little bit different than older technology, because hearing aids can do more than just help a patient hear.
That technology that you mentioned, I'd love to hear about some of the features that go into that, how long hearing aids last, and if you have any examples, that would be
Yeah.
great.
So, technology in the hearing aid world is really taken off. The devices now, they are rechargeable, so you don't necessarily have to have small hearing aid batteries to change. Most of the hearing aids that we work with nowadays have Bluetooth capabilities, so that would allow patients to stream all sorts of music or media. They could hear their TV through the hearing instruments. They could listen to their favorite podcasts, or, FaceTime with their grandkids through the hearing aids, which is really nice. The size has been, improved dramatically. So year over year, hearing aids are only getting smaller. This is one instrument that's a pretty common form factor that we fit. It's called a receiver in the canal. This device is really small. Lyric is another implantable device. So, you place this in the ear canal. We refer to it as like the contact lens. This isn't something that you have to, put on. It's just inserted into your ear, and every couple of weeks it's changed out. This is another really tiny in the ear option. So, completely invisible model. I think everyone acknowledges that nobody wants to have to wear, their grandfather's really big, really not so cool looking hearing aid. And so, with that, the manufacturers have put a lot of time and energy into making them cool and making them comfortable and making them as small as they can, because, then it just gets patients over that obstacle of like, oh, how is it going to look? What are people going to think when they see it on my ear? Getting it as small as it can be, has, helped a lot of patients kind of get over that obstacle of like, what will people think when they see me wearing this device?
That's amazing. So, with this newer technology, how long do you see a hearing aid typically last someone?
That's a good question. So, the durability and that sort of thing related to the hearing aids is only improved year over year. But because the technology is advancing at the pace that it is, I think it still is motivating patients to consider new hearing aids sooner. I would say the average patient is getting new instruments every 3 to 5 years, but it's just like anything. If you're the patient who always has like the state of the art phone, you may be getting hearing aids more often than someone who, has 2 or 3 generations old cell phone. Because the devices are being advanced so quick, that just means that the research is really they're coming out with things that can really enhance the sound quality and the performance. Um, the only thing with the advancement that I think is important to keep in mind is that there are some patients who really love all of these bells and whistles and the Bluetooth and the features, but there are patients who are just, satisfied without all of that. So there's options for everyone, and you don't necessarily have to get a device or even use all of the features that, the newer hearing aids have available, if you don't want to.
Like, there's a lot of variety there.
Yeah, definitely.
So, if someone were to get a hearing aid, what might maintenance look like for them?
Yeah, this is a good question. So it depends a little bit on the form factor of the instrument. There are some hearing instruments that, you need to change the tubing and you need to clean out the ear molds. There are others that have wax protection. You replace the wax protection, you replace the dome. All hearing aids have microphones, so you want to be sure that the microphones are clear of any debris using like a soft bristle brush. Our patients are often seen annually for hearing evaluations. At that appointment, we test your hearing and then recalculate or reprogram the hearing instruments that you have. And then they'll usually come in every 6 months for a thorough cleaning of the hearing aid where, we'll suction out the microphone ports, replace any parts and things like that that need replacement. And then on a more routine basis, where patients are changing those wax guards and domes on their own, is going to be sort of dictated by, the amount of wax that they have and those sort of things. So the patient's hearing, provider will be able to kind of counsel them on, what's going to be most appropriate. But that's pretty typical as far as, what the patients are doing throughout the year to be sure that they're getting the most out of their hearing aids.
I think one concern that some people might have is can you still be active and live your normal day-to-day lifestyle with a hearing aid? Can someone, for example, run around with their grandchildren or do an activity that they're used to doing on a regular basis?
Yeah, absolutely. I mean, that is every audiologist dream, is that you can live just an enhanced version of the life that you want to. I have patients who wear their hearing aids to Zumba, and I have patients who wear them on the tennis courts. I have patients that, are wearing them 18 hours a day. So they are really designed to become just a part of your everyday life. The manufacturers really are focused, on bringing a technology to the patients that they don't have to say, oh, wait, I can't do that because I have hearing aids, or oh, wait, I can't do that. I have to take my hearing aids out. So, no, the only time I recommend patients take out their hearing aids are when they're going to get in the shower or when they're going to bed. Otherwise, have at it.
Awesome. So you've mentioned some patients wear them for longer, 18 hours a day sounds like a long period of time to me. So the comfort level on that, I'm assuming not only have they gotten smaller, how's the comfort level on these newer devices?
Yeah. So, the options for customizing the form of the device has only improved. We can make custom molds that, fit perfectly to your ear. There are a number of different silicone shapes and sizes that we can attach to the device. With 3D printing, the accuracy of the molds that are being made have only improved over the years. And so again, technology continues to serve the patients and the field, because as those things improve, we're able to, treat and manage patients' hearing even better.
Sounds like there's been an incredible amount of improvement recently with technology, which is great. With all of that technology and updates in recent years, what factors might someone consider when they're in the process of choosing a hearing aid? And are there factors other than technology that they should consider when picking the one that's right for them?
Yeah. This is a great question, and I think it really does go back to what has motivated you to come in today. You are here for a hearing test. Where do you want to see the biggest improvement in audibility? And then focus the solution that we're putting together, you and your provider, to really identify, is it just in the restaurant environments? Is it at Zumba? Is it, and I keep going back to that because I've had such a patient that had such a profound improvement in her audibility in Zumba, that it was like, this is something that she's doing 5 days a week to really better her health and wellness. And it was a priority for her. So thinking about things like that, moments where you don't feel like you're hearing as best you can, identifying those moments, where are we looking to see the biggest improvement, and then finding a technology that's going to help in those environments that you're looking to see addressed. And between the audiologist and the patient, working through what your goals are, what do we want the device to look like? Is it going to go behind your ear? Does it need to go in your ear? And that really helps drive the decision process. There's a lot of resources now, and we've never had a more educated patient in front of us. But it does become really personal when you're looking at your goals, and then what are the treatment options that I have in my, in my toolbox to help get you to where you want to be. The biggest thing I would encourage patients to do is, if you feel like you're having trouble hearing, get scheduled for a baseline hearing test, establish care, with a practice like ours, or an audiologist, hearing healthcare professional, to really help guide you through the process. Because, we aren't working with your grandfather's hearing aids anymore. I mean, the technology is there, and there is a lot of evidence that suggests that, patients who are treating and managing their hearing loss sooner have better long-term outcomes. And I think that part is really important. Audibility is one piece, but, keeping patients, cognitively engaged, and, that whole mental health and wellness is a big motivating factor for a lot of the patients that come into clinic. So, if you haven't had a hearing test, I would say get that scheduled. And, I want to be a resource to this community. I've grown up in Alexandria, Virginia. I've been here, and we want to be a resource for patients that are just starting on this journey.
Dr. Cordero, thank you so much for joining us today, going through those questions. I think it's helped a lot of people kind of understand what the process looks like a lot better. I will say, for anyone watching this, you can reach out to us at EBW to find out anything EBW related at info@ebwllc.com. And we will also display Dr. Cordero's information right here for you as well. Thank you so much for joining us today. It's been a pleasure having you and kind of going through this process together.